Thanks, everybody. And I am a diploma grad, Jewish Hospital School of Nursing, so that's where it all started. Very proud of that education. And I'm going to ask Dr. Matt Hanley to join me for this section. Dr. Matt Hanley just joined SSM this summer. He's our new Chief Clinical Officer, and in that respect, he's my boss. So when I hand it over to you, you're going to welcome him with a profound element of applause, okay? And Dr. Hanley is responsible for driving strategies to achieve SSM Health's objectives in providing exceptional health care, partnering with employed and independent physicians, and optimizing education and research as appropriate in delivering our mission. Additionally, he serves as System Leadership's Chief Advisor on clinical quality, safety, and physician leadership development. Dr. Hanley comes to SSM Health from Atrium Health, formerly Carolinas Healthcare, one of the leading healthcare organizations in the Southeast, based in Charlotte, North Carolina. Since 2015, he has served as Chief Medical Officer for Atrium's Metro Group, providing leadership, operational expertise, and strategic oversight. He also served on the boards of Atrium's Clinically Integrated Network, Medicare ACO, and Third-Party Insurance Administrator, among several other leadership roles. So please join me in welcoming Dr. Hanley, and remember what I told you. Thank you. So you're going to stay right here. So Dr. Hanley and I are going to jointly work on honoring the first ever professional practice award winners in this section. So what we're going to be doing, we're going to go through each of the categories, and what you'll see up on the screen are the names of all of the people who were nominated. So first of all, let me just thank everyone who nominated individuals. It was a difficult process for the selection team, but I think as you hear the stories I'm going to share about each, you'll understand the why. So the first person selected, the person who nominated her said, "She deserves I Am Professional for many reasons within SSM Health and this ministry. Her current job as the clinical informatics specialist allows her to provide best practice by creating standardization to support our clinicians and patients of SSM Health using electronic documentation. She provides education and training to all clinical staff as needed and provides real-time feedback in code, rapid response documentation, while working with education in the simulation lab while doing mock codes. She facilitates and participates on multidisciplinary groups throughout the system to support the goals for SSM Health. She has shown dedication to lifelong learning by starting her career as an ADN nurse in 2000, achieving her BSN in 2011, and recently finished her MSN as a clinical nurse leader in August of 2017. She maintains certifications as a basic life support instructor, advanced cardiac life support instructor, pediatric advanced life support instructor, pediatric early assessment, recognition and stabilization instructor, and is a certified clinical nurse leader. She currently is active in many professional organizations, including American Nurses Association, American Association of Critical Care Nurses, and is the secretary of the Central Missouri AACN chapter in the American Nurses Informatics Association. In the SSM system, she is involved in the following: Nursing Leadership Council, System Nursing Informatics Committee, System Professional Practice Council, Regional Nursing Practice Council serving as co-chair, SSM Regional Practice Lead, Professional Nursing Practice Council serving as chair, the Critical Care System Collaborative Group, Care Plan and Education Working Group, System MAR Working Group, SSM No Harm Committee, SSM Patient Safety Quality Committee. She has helped with the setup and implementation of our DAISY Award program. She's a great example of living the mission within the SSM ministry. She's dedicated to our patients, visitors, and employees. She maintains open and positive communication between coworkers and other departments. She often will assist other departments covering staffing and patient care needs without being asked. One example, when our women's and children's unit was very busy, she stepped in and helped with phone and door control. We have always seen her help someone find their way in the hospital or helping a physician with the order sets or computer issues. The Fund Patrol, which she co-chairs, allows her to help show appreciation to all staff. She is always leading by example. Another example is that she comes into work and volunteers her time when a new process or product is introduced in the building. constantly calling and making sure the staff are comfortable and troubleshooting any issues as needed. An example recently was the Alaris integration project, where she was continuously on call for the 2 weeks of go live for anyone and everyone. In closing, I would like to sincerely express my appreciation for the opportunity of supporting the SSM Nursing Professional Practice Model Award of I Am Professional. I know of no one more deserving of this prestigious award than my dear friend and colleague, Jamie Hawkins, SSM Health, St. Mary's Audrain. I am professional. Jamie. Oh, fantastic. Yeah, they're going to come up and they'll have an award for her. They're going to give it on. Mm-hmm.
Congratulations, Jamie. You've got to be exhausted. That's wonderful.
Okay, I'm exhausted after reading her nomination. I don't know how she does it. That's fantastic. All right, and what you see on the screen are all the people who were nominated for that award. On to the next one. The I Am Advocate. The nominee has been an advocate since the day I first met her. As a new graduate nurse, I was wide-eyed and eager to learn every move my preceptor made to ensure that I would be shaped into the values, models that SSM upholds: professional, advocate, partner, accountable, and leader. It was difficult to pick just one category to nominate her for, because I believe she encompasses all aspects of her heart full of passion to care for others. Within the knowledge that she wholeheartedly imposed upon me, her determination to advocate for each and every individual patient without hesitation was most impactful to my development as a registered nurse. She inspired me to support my patients along their path of healing without discrimination. She encouraged me to support other nurses in my profession open-handedly, because she knew there would be times when I would be the one reaching out to others for help. She taught me to overcome my fears of calling doctors at unimaginable times during the night shift, to advocate for the patient, ensuring their safety and meeting their needs without any doubts. She has taught me to use my resources, other departments, intranet, policies and procedures, provided me with the knowledge that only a seasoned nurse would have, how to connect with even the most diverse patients, and believe in me even when there were times that I doubted myself. She's become more than just a preceptor to me. She is my mentor, my teacher, and my coach. She has bestowed upon me the knowledge of what it truly means to be an advocate for patients who may otherwise be lost in the world of healthcare without a voice to be heard. She helps each and every patient find their voice. She is an advocate. She advocates for her patients with special concern for those who are underserved and marginalized. She supports other nurses in her profession by offering mentoring, teaching, and coaching. The award this year goes to Shelley Kaplan, SSM Health, St. Mary's, Jefferson City. I am an advocate. Okay, and in case you didn't notice, we now have Laura Kaiser on the stage, and Laura is going to be talking to us shortly. Laura is our CEO. All right, on to the next award. I am a partner. Again, you can see many nominees. The person who was selected, this is the nomination. She is dedicated to the nursing profession. She has served in many roles in her nursing career and brings a valuable background to SSM Health. She provides exceptional care to our patients and displays presence every day she works. Over the holidays, she was caring for a patient. I'm not going to be able to get through this one, sorry. This is a hard one. Sorry. Over the holidays, she was caring for a patient with Alzheimer's, and he was very agitated and would become combative at times. This is very hard for family members to witness and experience. She always takes time to get to know her patients and their family members. In talking with the family, they shared how the patient loves singing and music and how his favorite song was Silent Night. She was going to be placing a new IV, and the patient was not cooperating. She knew it would be challenging. She decided to start singing Silent Night, and the patient became calm and started to sing along as well. The family members joined in, and she was able to place the IV, and the patient remained calm while she was doing this. She always does whatever it takes for her patients as well as her team. She is positive and friendly to all staff. She is respectful and works well with all. She's been willing to help in many areas of the hospital and has recently taken on the role of maternal fetal medicine, where she will continue to show her compassion and provide exceptional care to patients in need. One shift, while tasking in the family birthplace, a massive transfusion protocol was implemented, and she stepped in and assisted the team during this emergent situation to help achieve a good outcome for the infant and mother. These are just a couple of examples of many where she displays her nursing professional practice and her daily work and shows how she is a partner. Thank you for all you have done for our SSM Health patients, families, and team members. I am a partner, Deborah Callahan, SSM Health St. Clair, Fenton, and St. Mary's, St. Louis. Sorry about that. That was one of those stories that let's go straight to the heart. Those are all the other I Am partner nominees. The next nomination group is I Am Accountable. This is from the nomination. She has worked in orthopedics for years. She is self-motivated and always looking to advance her education. She continues to gain respect from physicians, leadership, and her peers through her desire to provide excellence in patient care. She's often asking the why we do the things we do, and could we do it better? She had the motivation to study and take the orthopedic nurse certification exam and pass. She has a positive effect on our orthopedic team, and they view her as a leader. She has precepted many nurses who have adopted her professional behaviors and are top performers on my unit. She attended the fractured hip orthopedic VSA value stream analysis and was an active participant and volunteered to be one of the project leaders. Her bedside experience and her push to be evidence-based practice helps to lead the team towards specific positive outcomes. She recently stepped up to be a fill-in charge nurse on my unit and was promoted to the CSN role shortly thereafter. She received her BSN in 2017, and through her forward-thinking mindset, she became interested in research with the need to improve patient care. She developed a poster on a clinical topic and submitted it to the National Association of Orthopedic Nurses, and she was selected to present this poster at the national conference this past May. She also will present this poster at SSM Nursing Symposium this September, which I hope you all got to see. And for these reasons, I am nominating her for the I Am Accountable Professional Nurse Practice Award. Lauren Page, SSM Health DePaul Hospital. And our last award, and that was the other I Am Accountable, I Am a Leader. And again, many nominations. And so this is one we're going to share, and it's our final one for the day. I would like to nominate an exceptional nurse for the I Am a Leader Nursing Professional Practice Model Award for his commitment to excellence, unparalleled teamwork, and professional leadership, powerful leadership. As a new employee and new graduate nurse in the emergency services, I had so much to learn. Throughout my orientation in the department and since, he provided exceptional leadership and mentorship to me and to our fellow colleagues. He goes above and beyond his duty to help whenever the need arises, regardless of his assignment within the department. I had a challenging pediatric patient that required an IV and blood work. I told him I needed some help. Even though he was assigned to a different team, he walked me through some tips and techniques as he has learned through his extensive emergency nursing experience to set me up for success when we went into the patient's room. Challenging pediatric patients not only require skill, but compassion. Afterwards, we talked about how it went, and he was encouraging and supportive. This was not an isolated event, but an everyday occurrence when working with him. He exemplifies leadership within our department. He single-handedly coordinated approval for a vegetable garden for our department, a use on the land owned by SSM Health outside of the emergency center. He connected with local businesses to donate extra lumber to build our garden boxes and to have dirt delivered to the site. The success so far with this garden project has visibly boosted morale and camaraderie among department employees and physicians. His exemplary leadership in nursing is the essence of SSM Health's mission to provide exceptional care to patients and to promote the improved well-being of others. Our I Am a Leader Award winner is Brian Pureling, SSM Health St. Mary's Madison. And through the magic of technology, we were able to get a hold of Brian. Since he could not be here, he is actually deployed. And so we're going to share his response. So once again, congratulations to the first ever award winner, all the nominees and the award winners that are here today. Congratulations to everybody. Did you want to do one of the full group? I have to superimpose. There you go.